Good morning, everyone. Welcome to this episode of the YVI podcast. I am Dr. Monique Y. Wells, coming direct to you from Paris, France. And I am so pleased, just a second because I'm letting people in as we talk. I am so pleased to welcome you to this edition of the YVI podcast. For those of you who do not know what YVI stands for, it stands for the Youth Veterinarian Initiative. And this is a program that my nonprofit, the Wells International Foundation, has been running for a couple of years now. We're in our 19th month, actually. And our goal, our mission, is to introduce Black and Brown youth to the idea of becoming a veterinarian or working in some other animal-oriented field, and also to introduce you to Black and Brown veterinarians and other Black and Brown animal professionals so that you can see yourself in them, so you can hear their stories, talk about how they managed to maneuver themselves into the positions that they're in now, how they applied to school, et cetera, and why they love what they're doing now. And so, let's see, just a second. I am doing everything, so I have to watch the waiting room, I have to watch the chat, and I have to keep talking with you. So we have several people on the call. I would like just to go around very quickly once again and ask where people are calling from. So I want you to, I'm going to call your name. I hope that I pronounce it correctly. I'm going to call your name and ask you to say where you're calling in from, and then I'm going to introduce our speaker. So going on my screen, the upper right, we have Kyra Thomas. Can you come off mute and say for us on the recording where you're calling from?
I'm calling from North at Marion P. Thomas.
Very good, thank you. Toyibat Hassan, come off mute.
I'm coming from Newark on BTCS.
Okay, great, thank you. And Diane Williams, can you come off mute and tell us where you're calling from?
I'm calling from Newark, Marion P. Thomas.
Very good, very good. And Christy Adeklat, I hope I'm saying your name correctly. Can you come off mute and tell us where you're calling from?
I'm calling from Newark, Marion P. Thomas.
Very good. We have Marion P. Thomas in the house today. Fatu Gomez, can you come off mute and tell us where you're calling from?
I'm calling from Newark, Marion P. Thomas.
Yes, yes, yes. Okay. Isabel Ilori, can you come off mute? Tell us where you're calling from.
Newark, Marion P. Thomas.
All right, I'm loving it. And Nantanin Mayembo, I hope I'm pronouncing your name correctly. Please come off mute and tell us where you're calling from.
I'm coming from Newark, MPTCS.
Yes, excellent. And we have Lisa Bruce. Lisa, come off mute. I know where you're calling from, but just say it for everyone.
Good morning, Lisa Bruce, Newark, New Jersey, MPTCS.
Absolutely. Thank you so much for gathering this posse. We are going to have a great time today. Our guest is Dr. Souci Louis, who is, you're in Atlanta, correct?
Right.
Okay, excellent, excellent. And Dr. Souci Louis is a practicing small animal practitioner. So she is actively working as a small animal practitioner, and she has an intense interest in public health, preventive medicine, infectious diseases. And Souci, Dr. Louis, I would love for you to give us a little bit more of an introduction to you. Start out by telling us why you wanted to become a veterinarian and how you navigated your path through school and to get your degree. And then we'll start to talk a little bit about what you do on a day-to-day basis.
Sure. Well, good morning, everyone. I want to say thank you for having me. It's nice to see a lot of representation here from the Northeast because I'm now down here in Georgia. But I'm originally from the New York area, Elmont specifically. And so growing up, I always had an interest in animals. My mom is a nurse, and my dad is not in the medical field. He had his own like auto repair shop, but kind of growing up, I was interested in science, and I really felt a deep connection to animals. And so combining that love, since I was a young kid, knew I wanted to be a veterinarian. I didn't realize how difficult that path would be until I kept applying to even different internships and volunteer opportunities and saw how competitive it was. When I was in college, I volunteered for a summer working at the New York Aquarium. I then volunteered another summer working at the Staten Island Zoo. I also volunteered at my local veterinary practice in the area of Elmont. So I had a lot of hours of unfortunately unpaid experience working with animals just to really get that support for my application. And so I went to Stony Brook University for college, which is in Long Island, New York. And my senior year, I applied for a couple of different veterinary schools. If you don't know, applying to veterinary school is really competitive because at the time, there's less than 30 veterinary schools in the whole entire United States of America. So there's not many spots that are available. And so the first time I applied to several different schools, I got rejected by many of them. And then some of them I was just waitlisted, which means that they have no spots for you in the class at that point, but should an applicant that was accepted decline and change their decision to go to another school or just not to go to that school, then you come off the wait list and they can accept you. While I was waiting for a position, I then graduated with my degree in biology from Stony Brook University. And then I waited for the timeline between that first class to start, and I unfortunately did not make it in. So then what I decided to do was work full-time as a veterinary assistant, or basically a nurse to the doctor, in a small animal practice in Brooklyn. And so I did that for a year after graduating college, just to really get more experience in the veterinary field, because I still felt after each experience, whether it was with zoo animals or sea animals or just dogs and cats, that this is something that I wanted to do. It just felt right to me to fulfill this passion for learning about science and medicine and applying it to working with animals. And so that year I reapplied to veterinary school again, just with a stronger application, with this year working full-time as a vet nurse. And unfortunately, I got rejected again, which happens because, like I said, it's a very competitive field. Many people who are veterinarians have applied to veterinary school multiple times before getting in. And so at this point, I was really heartbroken because like I said, I knew since I was a young kid that I really wanted to be a veterinarian, but I started to have serious doubts at this point if this was the career path for me. And so at this time, I decided to consider pursuing a different career path, just kind of while I figure out, do I want to get another degree and consider vet school, or do I want to just get another degree altogether, and maybe veterinary medicine isn't for me the way that I thought it was. And so even though I won't have the opportunity to work with animals as a vet, I thought I really do enjoy science, medicine, helping the public. And I decided to pursue a degree in public health. So I enrolled in a program at the Icahn School of Medicine at Mount Sinai, which is located on the border between Spanish Harlem and the Upper East Side. And I enrolled in the Master of Public Health program with a focus in epidemiology. And so what epidemiology is it's the study of how different diseases spread throughout the population. So definitely when the pandemic first started and COVID-19 happened, the world needed a lot of epidemiologists to figure out what was going on there. But when I applied to that program and enrolled in that program, I just really gravitated towards epidemiology because I think infectious disease is something that was really interesting to me. And of course, with a lot of different diseases that are out there. There's a lot of overlap with how they affect animals and where they came from. And so while I was enrolled in this 2-year program, trying to figure out where my career path was, I took a zoonosis class. And so what zoonosis is it's a specific term that means the spread of disease between animals and humans. And so in learning in that class, just more about infectious disease and how closely linked it is within the field of veterinary medicine, I fell in love again with the veterinary field, and I said, you know what, even though I applied twice and I didn't make it in, let's just try it one last time, because I really feel going into veterinary school, I want to become a veterinary public health practitioner. I really want to combine these two fields together, and it's something I'm passionate about. So during my last year of my public health program, I applied to veterinary school, this time making my application a lot more focused, and my goals to not just go in as a student wanting to be a general practice vet, but really wanting to make a difference in terms of combining public health and really relating health for humans, health for animals, health for the world just on a larger scale. And that last time that I applied, I got into several of the different schools I applied to. So it seems like I just kind of lacked the focus I needed, or all the things aligned. So that's a good lesson to, sometimes a lot of doors will shut in your face, but that doesn't mean they're shut forever. So I applied to several different schools, but the school that I chose to attend was the University of Pennsylvania, which is located in Philadelphia. So I moved from New York to Philadelphia, which was big for me because I've lived in New York my whole life, essentially, but I was happy to be in another city. And there I got training in veterinary school. You get training in many different areas of veterinary medicine. So I learned about horses and cows and dogs and cats as well, and zoo animals, all the experiences that I've had before, but I got to learn about them at a deeper level. But then we also learned a little bit more about public health and just how we can educate our clients and just the people around us about all these different aspects of working with animals and how they help humans continue to improve their health, and it's just a symbiotic relationship back and forth. So yeah, and then I graduated veterinary school in 2020. So in the midst of the pandemic was when I graduated. So that was tough for me since I had a virtual graduation, but I moved down to Atlanta because it's a great warmer city. I was very tired of the cold up in New York and Philly, and it's a major hub here for public health projects, considering that the CDC is located right in the epicenter here. And I now work as a general practice vet, meaning that I see dogs and cats, but we perform a lot of different procedures, whether it be internal medicine cases or surgery, or just even annual wellness visits. We kind of do everything in between, kind of like your primary care doctor. And I love the ability to combine my training with my master's of public health, just in kind of educating my clients about all these different measures that we can take just in terms of caring for our pets at home to make sure that they stay healthy and that we stay healthy too.
All right. So you said a mouthful there, and I have a lot of questions that I want to ask you, but before I get into that, I want to say to everybody that if you have any questions during the course of this session, either raise your hand by clicking on the little raise your hand button at the bottom of your screen. You have reactions, and then you can click there and there'll be an option for you to raise your hand. So you can raise your hand that way, or you can type your question into the chat, or you can even just come off mute, come off camera and say, wave your hand and say, I have a question. We had someone join us, Daryl Parsons. Daryl, could you come off mute just for a second and tell us where you are calling from, what city? And we'd love to hear that. Can you do that, or can you type it into the chat? Okay, maybe he stepped away. In any event, there's lots of questions that I want to ask with regard to what you've talked about. So first, you used a lot of words, you defined a lot of them. You talked about epidemiology, you talked about zoonosis. Let's see, where did she go? What happened? Our speaker left. Okay, we're gonna have to wait for her to come back. While we're waiting, does anybody have any questions so far about what Dr. Lewis talked about? No one. Does anybody have any interest right now in even thinking about doing any work with animals as an adult?
Dr. Wells, I did want to mention that Darrell is one of our scholars as well from MPTCS. So if he wasn't talking, he's one of ours as well.
Okay, great, Darrell. So sorry for mispronouncing your name. And Dr. Lewis is coming back. Dr. Lewis, can you come off mute and turn on your camera? Don't you just love technology? Oh, her laptop died. Oh no. Okay, let's see. I'm going to ask her if she can join using her phone. First, let me ask if she can plug in. Okay, can you plug into a wall socket or join using a phone? All right, while we're waiting for her, and I will keep an eye on the chat to see what happens there. Are you MPTCS students, are you reading right now A Day in the Life of a Pooh, a New, and You? Are y'all reading that now? No. Do you have that book? She's coming back. Okay. Okay, thanks for telling me. There she is.
Can you hear me?
Now we can, yes.
I'm so sorry about that. My computer was plugged in. It's just having some issues, but I'm here.
Okay, great. So, so we do have all of our attendees here are from MPTCS, so this is a wonderful thing. And I was going to ask you some questions about things that you said. You talked about going to get a degree in public health and then applying to vet school. A lot of times, people go and they get a master's degree or even a PhD before they apply to veterinary school. So there is a difference between a PhD and a medical doctorate degree. And they're all good, you know, there's nothing, you just have to decide really what you want to do. So do you believe that your master's in public health helped you to focus and therefore give you a stronger application to get into vet school, right?
Absolutely.
Okay. And then you said you moved to Atlanta and you said that even though you're a small animal vet, a practicing small animal vet, there's more public health, did you say that there are more public health opportunities in Atlanta because of the CDC?
Yeah. There's just being geographically located in an area where there's such a major public health hub. I got the opportunity to talk with either people who work at the CDC or just kind of other veterinarians, like veterinarians that work in the local vet med association that do a lot of public health work, that are able to give insight and just provide continuing education on incorporating public health into practice. There are definitely public health vets that do that in other states as well, but Atlanta just seemed like the right place for me with my career goals.
Okay. And so just for people who might not know, what does CDC stand for?
Yeah, so the CDC stands for the Centers for Disease Control and Prevention, and they basically send out the guidelines and do a lot of research behind the policies created for the better of the US public health. And so definitely when the pandemic first started and there was a lot of information about the vaccines and where to get tested, the CDC was one of the major governmental agencies releasing that information about how to stay safe.
Okay, excellent. And you talked about, you told us what zoonosis is, and that's the spread of diseases, excuse me, from animals to humans. The title of your talk actually is One Health in Practice, Veterinary Medicine in Our Community. And so I would like for you to talk about One Health and what that means in terms of public health and zoonoses and all of these other things.
Of course. So One Health, at least for me, combines the concept that there are human doctors, human practitioners working in the field of human medicine. There's veterinary doctors and nurses and whatnot working in this field of veterinary medicine. And there's also all these other different fields like an environmental conservationists working to improve our ecodiversity globally. And this concept of One Health really means that these different fields are not working just in their own separate world. It's we all working together to make the world a better place for humans, animals, the environment, just kind of any field that you're working in. There can even be lawyers, business people who are in their own respective concentrations, improving certain things. But with this kind of One Health concept, we can all work together on creating organizations, policies, different innovative tools to really increase the health of every being, every person, animal in the future.
Okay. And can you talk to us about some of the zoonotic diseases? I always tell people, if I want to talk about zoonoses, I always start with rabies. Because people, at least they've heard about that, and they know that if you're bitten by a rabid dog or a rabid cat or a bat or something, that you can get really sick and die. But there are lots of other zoonotic diseases. Can you talk about some that are more common that people might know about?
Yeah. So one of the diseases that I talk about, or rather the infectious agents I talk about a lot as a general practitioner, is Salmonella. Just something as simple as especially if you have like a pet lizard or a reptile, they can carry Salmonella on their bodies, which it doesn't harm them just because of how their microbiome, how the bacteria in their body works. But when we touch reptiles, or even when we go to zoos, petting zoos, and touch chickens and all these different farm animals, if we don't wash our hands appropriately, we can contract Salmonella to ourselves, which unfortunately, if some of you know, that can make our tummies quite upset. And so it's not recommended to catch Salmonella. So that's something we face pretty consistently. Giardia, which is a parasite that is found in the fecal samples of dogs, is something that can also be transmitted to humans, but we can also transmit things to animals as well. And so it does go back and forth. I know a lot of people have seen the prices of eggs skyrocketing lately, and really many don't know that that's because there is an avian influenza epidemic going on. So that means that the birds, the chickens used in to produce those eggs have been experiencing influenza and getting really sick. And so when that happens, that affects the egg production for the whole country. And so that's just kind of another area in which veterinarians, you wouldn't think about really overlapping into the food supply for the country, but it's a really important thing that a really important position that we hold. And it's just about educating everybody of how we're all in this world together with how we interact with our food, the animals that we see, whether in our homes or at zoos or at other exhibits. So it's really important to practice good hand washing hygiene and just be conscious of where you are and what you may be spreading.
Yeah, that's right. That's right. So Isabel has a question. Isabel, come off mute.
Okay, so my question is, I thought that salmonella, it only affected like dead animals. I didn't know if it was like you could catch salmonella if you touch something that's alive.
Yeah, you actually can. And so with lots of different bacteria like salmonella, you can yes, catch it on an animal that has passed, but also some birds, or even when some reptiles or like I said, some chickens in a petting zoo, if you don't wash your hands, they carry that salmonella bacteria on them. And so it's just always important when you're dealing with animals, or just in general, it's always important to wash your hands and wash them effectively. That's what we learned from this pandemic. But yeah, bacteria exists all around us, not just on deceased patients.
Yeah. And you talked about avian influenza. So that's influenza is the long word for the flu. So you've heard people say, you may have heard people talk about bird flu. So that's what that is. That's the sort of the common term. Avian influenza is the scientific term, and bird flu is the common term. And in France last year, duck is something that is eaten quite a bit in France, not so much in the United States. But there was a bird flu outbreak in ducks here last year, and you couldn't get any duck meat for months. So it is quite important. We've got Fatu coming back. So the next thing I wanted to ask you, Dr. Lewis, is about just even outside of diseases that can be spread by infectious agents. And so when we talk about infectious agents, we're talking about bacteria, we're talking about viruses, talking about fungus. But there are other kinds of diseases that people have in common with animals, even though it's not spread. So can you talk a little bit about those?
Definitely. That's another aspect of something I really like about being a general practitioner is the ability to kind of make those connections with my clients. And so, for example, a big one is diabetes. So dogs and cats can actually get diabetes as well. And so definitely for the first time when I diagnose either a dog or a cat with diabetes and I talk about giving insulin to them, I find that it's a lot easier to help owners understand the way that works and how much monitoring we have to do. If they know somebody in their family who has diabetes, or they understand it's really similar the way that we make sure that our dogs and cats are on a special diet, not to spike up their blood sugar. We need to give them their insulin injections regularly and just make sure that we have that chronic disease in regulation. Another disease that animals can also get is asthma. Some cats, unfortunately, can have what we call bronchitis, allergic bronchitis, or some asthma. And some cats actually have inhalers, just like humans, that we'll have to give them their inhaler medicine pretty regularly to make sure that they don't have an asthma attack that stops them from breathing appropriately. So there's a lot of different things that I think many people understand and see it, are familiar with seeing it all the time on the human aspect, but don't realize that, oh, our animals can get that too. And once we kind of start thinking about our world in a way of translating these concepts back and forth, it just makes it a little bit easier to understand and look out for some signs of these things. Like, for example, if you have a dog that gets really sensitive when it eats certain foods, maybe it has food allergies, just like how humans can have celiac disease and some people can be allergic to things like shellfish or lobster. Dogs can be allergic to different things too. And so when we start looking for things, we start to find that out. And that way we can use what we've learned in human medicine, just kind of like making sure we stay on the appropriate diet, or just really seeing how our pets react to certain stimuli. And it just helps us to care for them better and really understand what they may be going through, because they can't talk to us. So yeah, take whatever clues we can get.
Mm-hmm. Mm-hmm. I want to ask everybody, you don't have to come off mute, but just raise your hand in, using the little function, the little Zoom function. If you have a pet, raise your hand. Isabel has a pet. Anybody else? Isabel, what kind of pet do you have?
I have 3 fish.
Wow.
Oh, okay. Why did you choose fish?
I didn't choose it. My parents chose it, but probably because they're low maintenance.
Low maintenance. Okay. I got you. And Dr. Lewis, you, excuse me, you said you worked at an aquarium. So can you talk a little bit about your experience with fish?
Yeah, so unfortunately, when I worked at the aquarium, I was mostly with the sea lions. But yeah, I worked with the sea lions and basically preparing the fish that they ate each day. And helping them prepare for shows. But working at the aquarium, I got to see even the vets on that aspect when they're working with the marine mammals or the fish. There's a lot of work that goes into the water testing and constantly checking on the fish each day, making sure are we swimming as much as we usually do? Are we eating as much? And so just really picking up on little things day to day is so important, because the fish can't talk to us, or at least not in a way that we are used to understanding.
Exactly. Isabel, have your fish always been healthy? Can you come off mute, Isabel? Her hand is still up too, so maybe she's stuck. Okay, well, we'll come back to her. Hopefully she'll be able to unmute herself and answer that question. But I asked that question because there's lots of things that we have to do as a pet owner to keep our pets healthy. So I would like for Dr. Lewis to talk a little bit about that.
Yeah. And so when we think about what we need to do to keep ourselves healthy, there's a lot of overlap that goes into keeping our pets healthy as well. And so just how it's recommended that we visit the doctor at least once a year. It's the same thing that's recommended for pets. Actually, we recommend twice a year for them, just because a lot changes in a year, especially when they live a little bit shorter than us. And so just getting your vaccines every year, just getting your blood work done, and making sure that we're not noticing any changes that could be an early sign of disease. Visiting your vet every year is something that you can easily do, and kind of when you schedule your own visits, make sure, when was the last time that I brought my pet in? Another thing that we all can be better at is getting some consistent exercise. And so if you have a dog, it's pretty simple for you to take a walk while you walk your dog outside regularly. And it's just a good way to get exercise and a breath of fresh air at the same time. A little bit more difficult when you have cats that stay inside, or fish, but there's many ways to have them exercise. You just have to get a little creative. And so with cats, it's playing with a little feather dancer, or toys with them, or with fish, putting different obstacles or greenery in their tank to motivate them. There's a lot of things we can do to just make sure that they're exercising pretty regularly, just how we have to exercise pretty regularly as well to stay healthy. And then that also translates into diet. We have to eat healthy as well, and so do our pets. And so while sometimes it can be easy for us to give table food and holiday dinner leftovers to our pets at home, it's not the best thing for them, and we don't want to give them a big stomach ache and as well. So if we can remember to give them the diets that are best designed to keep them healthy while we try and eat healthy ourselves. There are some fruits and veggies that are excellent for dogs to eat. And so I have a little handout that I usually give my clients. It says, if we're eating our veggies like green beans and carrots, those are the good treats that we can share with our dogs that are pretty low in calorie, high in fiber, but something that's better than a big piece of steak. Not the healthiest for our dogs.
Okay. Darrell has typed into the chat that he has a pet cat. So what kinds of snacks would you give to a cat?
Yeah. So my cats are pretty greedy, and they like a lot of different fruits and veggies. The other day I was chopping up cucumbers and I gave them some cucumbers. I know around the internet there was a while ago a trend where if you put the cucumber on the floor, it would scare cats. And so I don't recommend trying to see if they're scared of cucumbers. I'd recommend just giving them a little slice of a cucumber to eat.
Are you serious?
Yeah.
A cucumber on the floor is scary.
Yeah, because some cats may kind of look at it and see it as a predator. It was an internet sensation a while ago. So
Oh my goodness.
don't recommend that.
That's funny. Darrell,
Yeah.
can you come off mute and tell us about your cat? Maybe he's shy.
Okay.
Oh, his mic is not working. Okay. All right then. But that's so funny. So I used to have cats too. I was allergic to cats and I kept them even though I was allergic to them, but I did not replace them when they died because then finally I could breathe regularly. Yeah, so that tells you how much I love them because they really, especially, it wasn't all year, but when the spring allergies would happen, the hay fever and pollens and all of that, then it was just over the top. And so then when I touched my cats, my eyes would water and everything. And it wasn't bad at all when it wasn't pollen season, but when pollen season came, they just, it was bad. Anyway, I didn't replace my cats after they died. I love them dearly. I think cats are great. And I used to be always a dog person until I moved to, I got my cats when I was in vet school. So yeah, it was, before that I never had any cats before. But anyway, we're digressing. So, okay, so you talked about the healthy habits we can do to keep our pets healthy. You told me in an email that you actually brush your pet's teeth. So can you talk about that?
Yeah.
There is a specialty in veterinary medicine, it's veterinary dentistry, but regular small animal practitioners and large animal practitioners for horses and cows, they do treat teeth. So can you talk about that?
Yeah, so a big portion of my surgery days and my weekly surgery days with my patients is doing dental cleanings and evaluations for them. And so just how it's important for us as humans to brush our teeth every day, twice a day, it's just as important for our dogs and cats. Every time we don't brush their teeth as the day goes on, they have some plaque and tartar buildup, which allows bacteria to form. And so, yes, there's definitely treats that we can give dogs and cats. There's even specific prescription diets that are enhanced to reduce the buildup of all that plaque and tartar on their teeth. The best thing we can do is brush their teeth regularly, just like we brush ours. And so it's easier said than done. Not many dogs and cats like you sticking the toothbrush in their mouth each time, but there's a lot of videos on YouTube and different Facebook groups and even TikToks on how to train your dog or cat to tolerate that teeth brushing regularly. And then something else that's recommended is doing dental cleanings on a yearly basis, maybe even more depending on the breed. And so just like for us, if we brush our teeth every day, we're doing a great job at trying to get rid of that buildup that happens. But really the best thing to do is to go to the dentist and have them use those special ultrasonic tools to really get all the nooks and crannies out. And then they also can take x-rays to look at the teeth below your gums and make sure that the roots all look great. And so we do the same things for animals as well, except because we can't tell our patients to open wide and to turn this way and the other way, we have to put our animals under anesthesia so that they can get their dental cleanings done. But that's just the major difference. But it's something that if we can get in the habit of brushing our pets' teeth regularly, like we brush ours, we can do a lot of good health improvements in terms of their oral care.
And is there a dog and cat toothpaste?
So yes, I highly recommend using dog and cat toothpaste if you're going to go brush their teeth, just because human toothpaste can have things in them that we don't want dogs and cats to get, and it's also not tasty to them. And so it's already an uncomfortable experience. We don't want it to make it even more uncomfortable. So there's specific dog and cat toothbrushes you can buy along with dog and cat toothpaste. And it's just important to, if it's pretty difficult the first time around to train them to just kind of sit there as you brush their teeth, you can take it by baby steps and try just brushing a little bit more each day and until we're able to just quickly handle the whole mouth.
Well, it's something else. Okay. All right. Does anybody have any questions for Dr. Lewis right now? I have one more thing I'm going to ask her, and then I'm going to ask her to wrap up. Anybody? Okay. So I wanted to ask a question about veterinary technicians / nurses. So you talked about doing that activity early on when you were preparing yourself to apply for veterinary school. So can you talk about the vet tech training process? First of all, can you tell us if there's really a difference between veterinary technicians and veterinary nurses?
Yeah. So in terms of a technician versus a nurse, as far as I'm aware, there isn't necessarily a defined difference. I just know that because some people new to the veterinary field don't really understand what the capabilities of a technician is, that we use the term nurse so they can understand, oh, they do the same responsibilities that a nurse does, just how doctors are nothing without their nurses, vets are nothing without our techs. And so with technicians, so I was a technician assistant, not a full technician. And so in order to be a veterinary technician, you can go to special training in which you enroll in a school program to be a registered veterinary technician. And you can take a test at the end, and that way you get your license. And so with that, you have the certification to help run anesthesia, to help calculate all these different fluid rates and whatnot, just essentially things that a nurse does for a doctor in the human capacity. If you don't have that schooling and that registration and that licensing behind your name, you're what's known as a veterinary assistant. And so you legally cannot perform a task to the full capacity that a technician can, but you can assist just kind of in restraining animals, helping drop vaccines, really educating the clients about a lot of the different aspects of diseases you see each day and how to take care of their pets at home with these different diseases in place. And so each state has their own laws about what a veterinary technician can do and can't do. And so coming from New York and now living in Georgia, I know even between those two states, the rules are quite different, but veterinary technicians really get to focus on the specific care of how we utilize these these medical procedures to keep our patients comfortable. And so while the veterinarians or the doctors get to kind of calculate and choose which procedures and treatments and medications these animals need, it's the technicians and the nurses that really are there for the day-to-day and interaction, and just make sure there's an appropriate follow-through when a patient is hospitalized and then sent home.
Okay, great. Diane Williams has a question. You can come off mute, Diane.
So my question was, I know there's dogs and cats with like there's deaf dogs or dogs with like memory loss, and my only question was, how do you help them through all of that?
So is your question about dogs without any hearing, dogs who are deaf?
Yeah.
Yeah, so unfortunately, there's no cure for any dogs that lose their hearing. But what I highly advise owners to do is to really get into the habit of using hand signals and just alerting the dog that they're coming. Just kind of don't sneak up on them and just kind of pet them while they're sleeping, to really just make exaggerated motions to kind of help them understand, oh, okay, you're approaching me now. Or sometimes with deaf dogs too, just as with humans who are hard of hearing, they tend to be a little bit more in tune with vibrations that they can feel when certain things are moving. And so like the dog may not hear a chair being pulled out from underneath the table, but they'll feel the vibration of that chair on the carpet or on the floor. And so sometimes it's actually harder than you'd expect for some owners to pick up that their dogs are deaf. There's not a short and fast way to make sure that a dog has lost all of its hearing. If you really want to get technical, you can have the dog see a neurologist, and they can put these little electrodes on and see if the waves go through the hearing pathway. But oftentimes how we check in the exam room is we try and slam the door, or somebody tries and whistles, and we see, oh, do we notice that happening, or do we seem unbothered? And then with the understanding that, okay, we may be deaf or lost most of our hearing, then we'll just accommodate and kind of teach them visual cues in order to do things like sit, stay, come, here's your food. And so you'd be surprised at how quickly dogs pick things up, especially because when their hearing goes, they accommodate pretty fast for things that you don't even expect. That also translates to dogs who lose their vision as well. Some dogs, as they get older, may lose their vision. And usually when that happens, I tell owners, don't move the furniture around in the house, because some dogs will be really comfortable and used to just knowing that chair or that table is always there and just kind of walking around it.
Does that answer your question, Diane?
Yes.
Okay, great. Does anybody else have any questions for Dr. Louis? Okay. So, well, first, I want to thank you, Dr. Louis, for spending this time with us this Saturday morning, and just sharing so much about your trajectory and your path to getting to where you are today, and the passion that you have for what you do today. And I found it really interesting that you talked about the vet techs being the people who are actually educating the pet owners about what is in essence public health. Mm-hmm. Isn't that right?
Yeah, I love it. The public health is everywhere.
It is. That's what I'm trying to convey here. That public health, it may sound like it's something that's really like, stiff and just way over in the corner, but public health is a part of everyday life. And it is part of what One Health is. And so I think more and more we'll start to hear about One Health just in the news and stuff like that. And so perhaps this is the first time the students from Marion P. Thomas are hearing about One Health today. So when you hear about that in the future, remember that you heard it here first. Okay, last chance for questions, and then I'll let you, Dr. Lewis, just say one, just give us some last comments and then we'll sign off. Anybody else for questions? I don't see any hands. I don't see anything in the chat. Okay. So go ahead.
All right. Well, thank you once again for having me. It's been a pleasure sharing my personal experiences and stories with you guys. If there's anything I'd want you guys to take away is that my journey through veterinary medicine and public health wasn't very linear. Sometimes life throws curveballs at you and then you realize perhaps this is the way that things were meant to happen. And it's okay to just kind of go with the flow and follow what you love. Then also too, the messages that public health is around us everywhere. And so whether I got into veterinary school and pursued the career that I have today doing public health, or whether I didn't get accepted in that last time and just had an alternate career where I worked on public health from the aspect of the human medicine side and detecting disease, it's a career path that has many different trajectories around it, many different ways to accomplish this overarching goal of improving the lives of everybody, whether it be their humans, the animals, the environment. And so there's many different ways to accomplish your dreams. And so just kind of stay committed and stay open.
Fantastic. All right. I am so grateful to all of you for spending your Saturday morning, a little bit of your Saturday morning with the Wells International Foundation and the Youth Veterinarian Initiative. And I hope to see Marion P. Thomas students on our YVI Book Club and Merit Badge program in 2 weeks. And be sure to come to our next podcast session, which will be in March, and the date will be announced, but we're going to be having a teen named Ava Dorsey who makes pet treats. She has a very successful organic pet treat business that is USDA certified. And so you'll get to meet her and hear about her story. She actually may become a veterinarian herself. So thanks again to everyone. I'm going to let you go now. Have a wonderful Saturday. I am going to upload this recording to YouTube. So if you want to watch it again, it will be available for you. And I will be sure to send Lisa Bruce the link once it's ready. Bye, everybody. And thanks again for joining us on this session of YVI Podcast.
Bye.
Bye-bye.